Welcome to the Celiac Diva!
Hi everybody, welcome to the Celiac Diva. I am Lauren Lucille Vassar. Wanted to share a little bit about what's going on with the FDA and gluten-free labeling. For anybody who may not know, currently there is absolutely no standard when it comes to labeling a product gluten-free as far as the FDA is concerned. So a company can label a product gluten-free no matter whether it's been tested for the presence of gluten or whether it hasn't, which, as a lot of you know, this has caused a lot of apprehension and fear, to say the least. So thanks to the efforts of 1in133.org, the FDA is on board, and starting as early as July to September of 2012, we're going to see an implementation of products across the board being tested for the presence of gluten to label their product gluten-free. Yay! Very fantastic news. So which leads me to why I'm letting you all know a little more about this. Currently, the FDA is in a commenting period of figuring out what that standard is going to be. What is going to set the standard for something really being labeled gluten-free? So we have a chance to go onto their website and let them know what we think, what our thoughts are, what your opinions are about what they're proposing. So what are they proposing? A little high pitch there. What are they proposing? They're proposing that products be labeled gluten-free, be tested for the presence of gluten at less than 20 parts per million. Some of the pros of that is that the Celiac Disease Center of the University of Maryland are completely behind it. Their studies have showed that 20 parts per million is safe for most celiac disease patients. If we do 20 parts per million, 27 countries overseas have adopted 20 parts per million. So we'll be able to import their products, and that will keep us keep a lot of products available for those who are living gluten-free. Another component or pro for 20 parts per million is that the equipment currently right now, the most accurate and consistent testing is at 20 parts per million. So that's what we're being told as far as that's concerned. Some of the cons, people are concerned because there haven't been any long-term studies of 20 parts per million. They're also concerned because what if they do have an autoimmune reaction when a product is 10 parts per million or 15 parts per million, then they continue to be left in a guessing game if something is labeled gluten-free. So that's what they're proposing. You have a chance to go onto their website and let them know what you think about that. They're also proposing a possibility of an option 6, which would allow products to either be labeled gluten-free or low gluten, which my personal opinion is that would cause a lot of confusion, more additional health problems, and that should be nixed. So my comment will be to the FDA, please, thank you for what you're doing, but no option 6, thank you. So that's where we are as far as what the FDA is proposing. And the next question you may ask is, why can't something be labeled gluten-free? Why can't it be 0 parts per gluten? Unfortunately, right now there is absolutely no test that will, with technology that we have available, to test something for as low as 0 parts per million. So that's where we are as far as that's concerned. That's what the FDA is proposing, and feel free to let me know. What do you think about it? And feel free to also, please do, go on their website and let them know as well. Thanks so much, everybody, and have a fantastic gluten-free